Welcome to the channel. You've made it to another video I post every single week. This is Dr. Jameson. Make sure that you hit the subscribe button below so you can get access to my content every single week that I post. This week, we're going to talk for the people who take care of people with chronic pain. I want to talk to doctors and nurses that take care. And also, I want patients to listen in so they can share this with their doctors. I want doctors to become comfortable again and know the legal parts of medicine that can hurt them so they won't be so afraid to treat the patients. And patients, I want you to know these things and share them with your doctor. So go ahead, hit the like button, hit the subscribe button, and get ready to share this with a friend. I'm gonna get the intro going and I'll see you after the break. So number one, let's talk about urine drug testing. Be careful with this. This is an area where a lot of our patients feel criminalized. They're feeling like you've already judged them before they even show up. Think about it. When you come into your doctor's office, I don't know if you have a doctor that you see, but imagine having to go in, partially disrobe, give a urine sample, and then wait to see whatever it shows. Every single visit that you see someone, or every other visit, or every third or fourth visit. Either way, this is something that is unpleasant. It's a bad experience for people. And imagine yourself in that position. So be sensitive to it. Make sure you know your state and federal regulations regarding urine drug testing, especially due to your own state, and follow them. Do not over-test. Don't test more often than you need to. Do not overbill. Don't charge patients more than what they should be charged for the test. Make sure if you're getting confirmations for your test, make sure that they aren't overbilling your patients. Be careful. A lot of your patients, including myself, we don't have insurance. So we aren't going to, if you have your own business, you aren't going to have insurance. You're going to be self-pay. So be careful of that because a lot of the confirmation companies are taking advantage of patients by sending them bills. Then the office sends them a bill and they're being double billed. And this won't fly. So be careful with that. Second part I want you to be careful about is false positives. A lot of patients, as you see, are suffering from doctors getting false positives due to any number of false readings. So make sure before you jump to a conclusion, get your confirmation and then go to the patient with all of this information. The third thing I want you to do regarding urine drug tests is I want you to make sure that you write the result in the chart the day that you do it. I don't want you to wait or delay it. I don't want you to pass this off. Do not delegate urine drug testing and the results to someone else. This is the number one way that you can become injured as a patient and a physician, because all that happens later is your charts are reviewed. It's found that you missed or may not have seen a urine drug test result. And if prescriptions were given, treatments were given, that's a sign of fraud in their eyes. That's a sign of giving someone an illegitimate prescription in their eyes. And I just want to keep you safe and keep your patients safe. So make sure when you get a result, document it in the chart, go over it with the patient, discuss these things with the patient, make sure they understand what happened. And also if there's action taken, be it if there's a probation, a suspension, or a termination to weaning the patient off, or even if you send them to an addictionologist of some sort, document an action in the chart. Every time that you get a test result, you may say, hey, everything was consistent, continue course of care. Everything consistent, this looks good, okay to treat. Or this was inconsistent, we want to take further action and this is the action. But don't just have an empty result in the chart that's not signed off on, that does not show anything. This should be done every single time you order a test. So if you are going to test, be sensitive to the patient. And if you do get the results, immediately have it placed into the chart. And I recommend that the doctors do it themselves or the nurse practitioners do it yourself. Discuss it with every patient. Do not delegate this thing because this is one of the number one ways from a medical legal standpoint that physicians can be charged and hurt significantly by missing out on results and later having them scanned into the chart. And you may have never seen it, but you will be held medically responsible for it. Just some advice. Okay, back into it. Number two, let's talk about your charting. Let's talk about your chart specifically. A complete chart is what's expected of a physician or nurse practitioner as they're seeing patients from time to time. The chart should be complete. If you're giving someone a treatment for pain, management, you need to have a complete chart. I'll tell you the components, and if you do not have these components in here, it sets you up for charges for illegitimate prescribing. So make sure you have these things in there before you start prescribing pain management treatments, especially if you're prescribing medications for a patient. Number one, old medical records should be present before you write your first prescription. Make sure that you don't just take your patient's word for it. This was old training, and it was the training that I was brought up on. Make sure that you have old, complete medical records. It will not fly for you to have someone with a diagnosis of chronic pain, but you have one note from 5 years ago, and someone complaining that they have chronic pain and have been getting treated consistently. You have to have notes to back that up. So make sure that you have the evidence right in the chart. If you don't have it, you need to pretty much start from Genesis, unfortunately, or they'll have to produce those records. This is going to be one of the number one ways you can keep yourself and your patient safe. Patients, make sure that you bring all of your old records to your doctor. Number two, fill in your HIPAA authorization form. That lets you have access to all the places where your patient may have gotten imaging, different scans that were done, CT scans, MRIs. Make sure you have evidence of these tests being done, nerve conduction studies, everything being done in the chart before you start treatment. So it should be as easy as you call in and say, yep, come in this day for an appointment. No, you're going to have to be able to get old medical records sent to you before you initiate the initial treatment. So you're going to have to kind of slow down, take your time when you bring in a new patient. Make sure you have the information you need first, so legally, the patient won't be hurt. Because the worst thing you could do is bring someone in, accept them as a patient, initiate treatment, not have the background information. You send out HIPAA authorization forms week after week and find that the places aren't open, the places have been shut down or aren't available or aren't responding to you, but you have a patient still getting medications from you and you have an incomplete chart, which ends up for allegations for illegitimate prescribing. This hurts patients because later they could be taken off of their medications and go into life-threatening withdrawals. So make sure you're careful and have the information before you take them on as a new patient. Therefore, it saves the patient trouble, it saves you trouble, and keeps you safe. Number two, make sure that you have evidence of any treatments that the patient has taken. So you need to have evidence that the person has tried and failed a trial of anti-inflammatory medications, because this is from a legal standpoint what they expect. In the medical world, we know differently, but today I'm giving you the legal ramifications of things you need to do. So anti-inflammatories and conservative measures first. If they've had physical therapy, there needs to be a consultation for that in the chart, or you need to have evidence that the person has taken physical therapy. Besides, I took physical therapy 10 years ago, it didn't work. No, you have to have something from the physical therapist. So make sure you get old records of those categories beforehand. Any surgeries, you need to have a surgical note, surgical progress note, operative note. Any imaging, have an imaging note. If you have any lab tests, have those results. If you've had physical therapy, have those results. Don't just have one note in the chart. It needs to be a complete chart. One of the last things, make sure you have a copy of your doctor-patient agreement where you describe all the risks and the complications that can happen from taking pain management medications. You need to talk to your patient about every prescription that you give them. And I'd recommend that as you're writing the prescription, you talk about the risks and complications every single time. This is an expectation from a legal standpoint. That's what they're going to expect to see from you. So make sure that you discuss this with your patient every time. And in your chart, document that discussion every visit. Undercover surveillance videos will look for you to do this, and they will say you did not do it. So make sure you check a box and state, discuss this with the patient every visit, along with having them sign like the pain patient agreement, which should be in their chart. Every time you write a prescription, discuss it in person again. Even if you have the previous month, make sure that you discuss it every single time so you can update the chart and state, still reminded patient of risks and complications, still reminded patient of risks and complications. Do a risk stratification, ask them how they're doing. Do your 5 A's every time and document that in your chart every single visit. And the last thing I have here is you need to have some sort of screening tool, a screening tool for pain and addiction. That should be in your chart. So make sure that you're testing patients for pain, testing them for addiction, and use the screening tools that you may find online. Make sure they're clearly delineated in your chart. And every 3 to 6 months or so, be sure to test again. You could just send them in the lobby to do the test, or send them to a private area to do the test. And make sure you have this in your chart because it is needed, necessary, and from a legal standpoint, this is what they expect to see. I know some of it doesn't make sense from a medical standpoint to do it so often, but you don't have to charge for these things. You don't have to bill for these things, but you need to make sure you're being safe. I'm pro-patient, and I know that you are for patients. So do this for your patients. You don't have to bill for them, but make sure it's in your chart. It saves them money, it saves them hassle and time, and it doesn't really cost you. Number 3, this one's a big one, but it's not the biggest point I'm going to discuss today. Know what you know and know what you shouldn't know. There are some things you should know, but there are some things you will never know, but you need to know exist. This is because these things that you don't know can hurt you, and they hurt you secretly, and you're held accountable for your actions. But I will let you know this is what's going on. These are ways you can be hurt, and these are ways that are hurting other physicians. If you're looking and Googling and searching and making sure that you're doing the right things from a legal standpoint, this is different than the medical world. Just know that lawyers go to school for law. They only have an understanding of the law. They may read a medical manual, but they only really understand the law. Doctors go to medical school. We don't really know the law the way they would know it. We know medical rules, but we know medicine and science, but we don't know the law. So when you get dragged into a courtroom or some legal fight, it's going to be based off of the law, not off of your medical intent, your medical training, and your science. Is based off of the law and their interpretation of it. So these are things that doctors don't really understand. So I'm here to break it down for you. The things that you may not know and the things that you don't know are about if you have unknown diversion. That means if you have someone who is savvy enough, and this is the problem with urine drug tests, you have someone provide a sample into a cup, you test it. Well, most of these medications, if they just take the medications a couple of days to 7 days before they do the urine drug test, what are they doing with all those other days of medications if it's a 30-day prescription? They're going to test with the medications in their system, but they wouldn't have had to take all the other medications. So that could have a false positive. That could have a false negative. But all in all, don't rely on just the urine drug test and say, aha, this was wrong, so that patient is bad. Or aha, this was right, so that patient is angelic. No, just know what you don't know. And that's unknown diversion. If someone wants to beat you, they can think all day about how to. You're busy taking care of people. You're studying, researching other techniques while they're thinking of ways to beat you. So you cannot win. So unknown diversion is just what it is, unknown diversion. And this is the danger of how vague the laws are with chronic pain management right now, that doctors are being held accountable for others' actions. Even though they had no direct knowledge of it, you're being held of it because of not what you knew, but what you should have known. Okay, so just know unknown diversion, you can't beat it. People are savvy and they can beat you if they really want to. The urine drug test can be beaten. You can beat it and you know how. But patients believe me, they know how to as well. So I already gave you one scenario that the person doesn't have to take probably 14 days worth, just take the last 7 days or so. And hey, they're gonna have it in the system when they do the urine drug test. This is dangerous. So you need to be very careful about relying just on one test to make your decision. And from a legal standpoint, I don't see how that is the proof of, hey, yes, this person needs the medication. They had an MRI that showed all these problems. So yes, they need medications the rest of their life, along with urine drug tests, which are always consistent. Okay, they're great, but other people aren't. I think when you generalize, you make big time mistakes. So I don't agree with that, but I'm just letting you know what the law is. Number 2, you don't know if there's an investigation. There are investigations which are always undergoing for the highest prescriber in the state. You don't want that to be you. So you can do something on ProPublica, ProPublica.com. You need to make sure that you search your name on ProPublica as well as the other members of your group. You don't want to be the highest prescriber for anything, because if you are, just know that you are the target. If you're in the top 10 or top 20, just know that you've already been targeted. And the fear of having the legal consequences happen now versus years from now is the more patients that you see over time, you're charged not only for the patients that are in question, but for every prescription that you've written, you will be charged for. So that could be 5, 10, 15 years for, until you're almost like El Chapo by the time they've pretty much calculated up the milligram dosages that you've always prescribed. You're charged for every prescription you've ever written in a conspiracy. So make sure that you are aware of this, and make sure you won't know about investigations, but these are things that can hurt you. They investigate pharmacies, they investigate doctors, they investigate physical therapy suites. There are investigations going on all the time, and every single week I see this on the news or in news feeds. So make sure you're doing something to take care of yourself. If you have questions, please send me a private message so you can keep it sensitive. I can answer questions for you on how to keep yourself safe and things you should know that you just do not know. These things aren't a part of your training, and I just don't want to see another person hurt. No patients hurt, no doctors hurt. I need to see this thing end. I need to see people safe. Next thing is our sponsors. You won't know if your patients are being sponsored because they will show up like a real patient. It may very well be. But just know that if someone's unable to work, they're on disability, getting $600, $800, $900, $1,200 a month. In some cities, that's not enough to even cover most of your expenses. So just know that some of these people are being coerced by a sponsor, or a sponsor is a business person. This is a criminal. This is a person who hires people to pose as patients and to bring them the pills, and they give them $100 or $200 and they sell the rest. Sponsors can ruin your practice for other legitimate chronic pain patients. They aren't known to other patients that are there legitimately. They aren't known to doctors. But please believe what happens is these sponsors are usually ringleaders. They're caught by authorities. And because they don't have name value and they don't have really a notable savings, they easily plea deal and say, yes, I'll turn in the doctor. I'll implicate the doctor and blame it all on him. He's the one. I couldn't have done it without him, even though you may have never known this person. But this is what happens to so many doctors. You always see some sponsor, some drug ring in affidavits. You should read them. You should look at search warrants. If you're in this field of taking care of chronic pain management patients, you definitely don't only need to look in textbooks. Look at the legal parts so you can keep yourself and your patients safe. That's your duty, because now I'm letting you know, I'm making you aware. And then know the things you should know. And these are the red flags that are already published, but the things you need to pay attention to now. And most of you are aware, since you've seen that they're now charging doctors with different things. You need to make sure you're aware. So know the red flags, patients traveling from long distances, anyone out of state, if they're calling early or requesting early refills, if they only want pills, if they only want specific medications, if you're getting ER visits, if you're having urine drug screens, which are inconsistent, if they're not filling all the prescriptions. Let's say you write prescriptions for muscle relaxants, write prescriptions for some sort of anti-neuropathic medication, write prescriptions for anti-inflammatories. If they aren't getting certain things filled and only getting the opioid-based medication filled, then you know there's a problem. So make sure that you don't sweep anything under the rug. Make sure you are vigilant with your patients. If you have nurse practitioners, make sure they know this too, because you're signing off on these charts. Make sure that you know that you're going to be held responsible, even if it is someone else who saw that patient. So if you have 1, 2, 5 nurse practitioners working underneath you, make sure that even though you won't catch the smallest thing, they need to be properly educated, but you need to know that you're responsible. So if you are signing off on charts, you're responsible for those charts. Even if you didn't see it, even if someone didn't discuss it with you, even if that result was never seen by anyone and it was just scanned in and you all missed it, you all will be responsible. But at the head of that chain will be the doctor. The second will be the nurse practitioner. And you will definitely be legally responsible. Even though medically, I understand, legally, they never do, because this is the law and they only go by the letter. All right, so this is the last one I'm going to go over with you today. This is for your physical examinations and how to use your examinations appropriately so they're legally appropriate. as well as how to get them into the chart, because I know a lot of you are busy. I'm going to give you, from someone who's owned their own practice, I need to give you some advice. You need to make sure that you're very careful and slow down at this point. I want you to do every examination as if you're being videotaped, audio taped. I want to make sure that you stay safe, because this is one other area which I keep seeing in affidavits, which I keep seeing in search warrants, that physicians just don't understand. What they're doing is they're videotaping how long you're spending in physical examination of your patient. As a busy healthcare practitioner, the only thing you're thinking about is, hey, what's going on with this patient? How are they doing? Are they safe? And what's going on today, and how can I make them better? You aren't thinking that I spent 50 seconds versus 2 minutes versus 5 minutes versus an hour with the person, because sometimes you get enthralled with the conversation. But they are looking for something from a legal standpoint that you're doing wrong. So let me tell you how to be safe. Slow down. Take your time. Make sure that if you schedule patients, be careful with triple booking. Be careful with double booking. Make sure that if patients are double booked, you're having enough time to spend time with that patient. I know there are no shows, but you're going to have to eat those costs, because in this medical legal environment, you won't win. So make sure with your scheduling, it makes sense. Make sure you're spreading these things out. Like I said before, reach out to me if you need some more specific help, so you can keep sensitive things sensitive, and so you can keep your anonymity on here. But make sure that you're being careful about your scheduling. Don't overbook. I want you to know that they're looking at exams and calling them cursory. That means cursory exams means you didn't really examine the person at all, or you examined them for a minimal amount of time where you couldn't have gleaned much information from the examination. That's what that means, a minimal examination where you couldn't have gotten much information because it was so quick, it wasn't thorough. This doesn't mean that the first time you saw them it wasn't thorough, but they're expecting a thorough examination every visit. They want you to do the examination as if it was the first time every time. This is the legal understanding. Even if they say it's not, they hold you accountable to that, and they time the examination. They time how long you're spending touching the person. So I'd say that if you have patients, you may need to make sure you glove up, you make sure that you are taking your time, and you make sure you document the time that you're in the room in minutes. You also need a secondary marker where you time the amount of time that you spent with the physical examination. I suggest that you make sure this is accurate, because if they do an audio visual surveillance with you, which they will be, make sure, if you're treating chronic pain patients, which they will be, make sure that you're able to do this. Now, these things I mentioned aren't possible for someone who's billing and charting themselves. I'm recommending all of you invest in a scribe. Get a scribe. Get someone where you can actually focus on the patient so they can do the writing. They'll have a small timer with them in the room, a stopwatch, and they can push that timer and show exactly when you came into the room, push that timer when you leave the room. And that was the total time you were present in the room in discussion. Secondarily, they need a secondary timer just for the physical examination. You need to push that timer when you start your physical exam, push that timer when you stop the physical exam. These things need to be placed into the chart. This will save you, because later on, if you're ever accused, you can always say, I spent this time with the patient. Second, don't just focus on what the patient is there for, because even though we're specialists, their understanding is, well, he only touched my back for a couple of seconds and that was it. So he's a bad doctor. Well, this is what they're going to say, even if you're excellent. Don't harm the messenger. I'm just giving you the message. Look, I know it doesn't make sense from a medical standpoint, but from a legal standpoint, this is what they're looking for. Make sure that you just do a comprehensive exam every time you see the person. I just do a brief head to toe and a neurological examination. And I want you to make sure you document that into the chart every single time. Save yourself. Do not let them call your exams cursory by not doing a focal examination. I would not do a focal examination again in this legal environment. It's too risky, and they don't understand what you may know, because your years of experience, and you know that patient, but the different people coming from a legal standpoint don't know patients and don't understand medicine. So we have to practice as if we're under surveillance 100% of the time. So please do comprehensive examinations, even on your follow-up patients. If you're seeing chronic pain sufferers, just because you're living in a different legal environment than other specialties, owe it to yourself, owe it to your patients. Make sure that you slow down and explain what you're doing the whole time. I'm going to tell you the benefits of the scribe. You need chaperones in the room. You need someone who's present, who can vouch for what you did. So a good scribe can act as a chaperone for you. The second thing is it reduces errors and recall. So remember that by the end of your encounter, you may have discussed so many things and you may be so busy with phone calls and you have to call this one back. You have questions from other people in the clinic. So just know that you do forget things. Everyone forgets things, but you're still being held accountable to a totally different legal standard. So your scribe can make sure that you don't miss anything because they're typing things up as they go. The third and final thing is you can focus on the patient and not on your charting. And that's the biggest issue. We're so busy taking care of so many non-medical things until we can't just focus on our relationship with our patient and focus on the problems they're in. So that's why you should get make sure you have a scribe. And I just wanted to make sure I gave you some practical tips on physical examination. Thanks for watching my video. Thanks for supporting me. I hope some of that was helpful for you and you can implement those changes today so they can help your patients and keep you safe. As always, I just want what's best for you. I don't want anyone to be hurt. I don't want doctors to be hurt. I definitely don't want a patient to be hurt. And I want you all to be safe from a medical standpoint, but also from a legal standpoint. And that is why I'm doing this series of videos, the last 2 videos especially. From a legal standpoint, there are things my patients just don't know. And there are so many things that doctors just don't know. So I'm here to kind of bring truth to you so you can make sure at least you've been informed. Now, whether you decide to act on it, then that's on you. But at least now you've been informed of the legal environment that you're involved in and how to combat it. As always, guys, hit a like, hit the subscribe button. Thank you so much for supporting me, and I'll continue to support you until the next video. Take care of yourself and take care of others.